Hi, I'm Samantha Callan and I co-founded the Family Hubs Network with Lord Farmer. This was part of our drive to develop policy at a national and local level to ensure families can overcome challenges, have better lives and help their children to fulfill their potential. And very quickly, the Family Hubs Network connects those running the existing 150 or so hubs to each other. We advocate for the spread of family hubs. We disseminate news about innovative and effective work, examples of good practice, journeys of system change, and how they've formally and informally evaluated their progress. We provide consultancy services to local authorities who want to develop family hubs models. So please do visit our website to find out more. Now, Aidan asked me to provide a national focus and to talk about how family hubs can contribute towards the prevention of childhood adversity and trauma, and how they fit into the government's latest early years plans set out in Dame Andrea Leadsom MP's review. Nutshell, I'll hold that one until a bit later. So in a nutshell, to prevent childhood adversity and trauma, families need the right help at the right time, and this does not happen by accident. It needs to be properly funded and delivered through consistently good, nationally available infrastructure which meets bespoke local needs and conditions. I'll return to this theme, but first, family hubs are not new kids on the block for family policy. Way back in 1949, one of Labour's own architects of the welfare state, Michael Young, called for child welfare centres. He saw family support as an essential pillar alongside health and education to help preserve parental responsibility and address the emotional cost to children of high post-war levels of family breakdown. And they're also unfinished business from the Children Act 1989, and in many ways inheritors of the Sure Start legacy. So family centres were the only support infrastructure explicitly mentioned in the Children Act, but they've been somewhat missing in action since then, although the early years were well supported, in many cases through children's centres. And not only is there much to learn from children's centres, but the work they do or did is an essential part of what family hubs offer. So Andrea Leadsom's second action area in her early years and healthy development review is that every family should have access to a welcoming family hub, which co-locates whole family support with universal and targeted early years services. Attending hubs raises new parents' awareness of other support they might need as their children grow. And in terms of the relationship between family hubs and children's centres, Andrea put it very well, saying the aim is to draw children's centres into family hub networks in all communities. So what do I mean by family hubs networks? Well, I'll put that slide up now. The way this works will vary across the country. Some children's centres have effectively turned into full service family hubs. And I'll explain what I mean by that in a minute. Others provide the early years offer in a community in partnership with family hubs and other delivery sites. So the combined effect of that family hub network is that families with all ages of children get early help to prevent, where possible, adverse childhood experiences from accumulating and mitigating their effects. So prevent and mitigate. Now, this APPG is very familiar with the kind of ACE catalogue: parental substance misuse, witnessing and being caught in the crossfire of domestic violence, other types of abuse and neglect, as well as parental mental illness, divorce and separation, and parental imprisonment. And to reiterate, preventing these from happening in the first place and reducing trauma to children by intervening early so their effects do not multiply and scar their childhood has to be at the heart of family hubs policy. So just quickly returning to the early years, workforce is vital, and the Leadsom review emphasises the importance of developing a modern, skilled workforce to meet the changing needs of families. And another action area for Leadsom is the continual improvement of the Start for Life offer. And this imperative for constant improvement is very much part of the Family Hub's ethos. It's not about saying, oh yes, we have family hubs in our area, but rather we have embarked on the Family Hub's journey of change, which means we are constantly working to get better and better at preventing and mitigating, as I said, the harms of ACEs and subsequent trauma and all the other things family hubs do. So to reiterate, family hubs are networks of people and places within a community working together to reach and support families who need help. They come in all shapes and sizes. They come in public buildings such as converted children's centres, buildings within school grounds, libraries, buildings run by the voluntary sector, churches, mosques, community halls. But what they have in common is easy access, a warm welcome from staff who know not only about what's available in the hub, but they have an extensive knowledge of the other people and places in the network. So within that network, these other places offer families' activities and supportive relationships in an integrated way, and connectedness really is the key. So in summary, family hub models enable every area to make the most use of their buildings and delivery sites that are available. So just putting it in a different way, the Family Hub network delivers the family help. This is all about the offer now. Family hubs deliver the family help, very helpfully defined by Josh McAllister in the Case for Change in his care review, in his independent care review. And that report said, the aim of family help should be to improve children's lives through supporting the family unit and strengthening family relationships to enable children to thrive and keep families together, helping them to provide the safe and nurturing environments children need. He goes on, family help should recognise that all families need help at times, and that does not mean that as a child protection concern, it should be able to confidently hold risk whilst also being equipped to recognise child protection issues. Support offered has to be grounded in the context of family life, including the communities and circumstances in which families live. It should build on family strengths, drawing on the wider relationships families have, and on the capacity and potential for support and advice from within local communities. That help should be available to any family facing significant challenges that could pose a threat, providing their child a loving, stable, safe family life. And family help would provide support with parenting, helping parents and carers manage children's behaviour, improving the relationship between parents, supporting families to protect their children from exploitation or harm within their community, and provide respite for parents of children with disabilities. We're almost there. It's such a helpful definition. That's why I'm saying it in full. It would support adults with challenges that impact on children, including support with parental substance misuse, mental health, physical disabilities, or domestic abuse, as well as helping to manage and mitigate other stresses on families, such as poor housing and debt. So you can see how all this is working together. And to pick up that wider policy story that the review is part of, at the end of 2020, we were all still in the depths of the pandemic, the Department for Education announced that family hubs would be rolled out across England. And hopefully before the end of this year, they will have outlined more of that family hubs policy. Now, the National Centre for Family Hubs, there we go. And that will be launched on the 2nd of November. And on the funding front, the all-important funding front, the government will announce how that £10 million transformation fund will help a cohort of local authorities to transition to family hubs, how that will be spent. And we're also, along with hundreds of others, I suspect, helpful for more good news in this particular area from the spending review. But whilst the government will be specific with local authorities about what they want family hubs to do, there's a growing consensus that the approach will be more principles-based than prescriptive. So very quickly, family hubs principles. So I mentioned the importance of connectedness earlier, but the Family Hubs Network, we talk about applying 9 principles of working to a family hubs model. The first 3 are, I think, pretty implicit. In fact, all of it is implicit from what I've been saying. But the first 3, for example, access, it's ideally not just through referrals, but also by parents knowing they can just walk through an early help front door and get support. So outreach is really important, making sure minorities and marginalised groups know what's available. And that's in the area of the second major principle I've talked about already, early help. For third principle, all families with children aged 0 to 19 up to 25 with SEND. Now, everyone on the call will know we have been talking about early intervention for over 2 decades, but I think we're at a tipping point where it's now acknowledged by the government that a more systematic countrywide approach is required, because raising children is challenging from the get-go, particularly for many vulnerable families. So number 4, early years support from conception up to 5 is an absolute must. This spans from essential health services like antenatal care and baby checks through to parenting support, addressing families' wider needs, as we've already said, employment, training, welfare support. The next principle is that family hubs exude a relational culture. People are focused on being welcoming, ready to engage, not being kind of done with their family until they're absolutely sure that they're being safely supported. And often that's about being very aware that the presenting problem may not be the core problem. So, for example, a dad may turn up and say, I'm really struggling with my 8-year-old. A parenting course might not be the answer. And perhaps through conversation, it's discovered mum's recently walked out, he's lost his job and he's depressed. And a relational approach helps families to access the right help with warm referrals, such as by going on a first appointment with them. Now, you'll notice there was a kind of relationship crisis in that scenario. And apart from early years support, relationship support is the only other service we kind of specify in the principles of family hubs, because it is so very important and often neglected. Separation from a parent is an adverse childhood experience, potentially fraught with trauma, especially if one parent simply disappears from a child's life. And often relationship conflict is central to a family's problems. And without help for a couple to improve either their relationship or their co-parenting relationship, if they do separate, the negative impacts upon children will accumulate. So to normalize and champion couple relationship support, those working with families need to be proactive and to talk about couple support with empathy and confidence, and not be embarrassed about it. 7, a whole family approach makes perfect sense from what I've just said, obviously. Families often face multiple challenges and they need that holistic approach. Organisations working together in number 8, in integrated way, that helps ensure families get a seamless, empathic and non-stigmatising experience. And that means sharing information and working towards shared goals, shared outcomes. And finally, the 9th principle, that means including the voluntary sector and the community. On that point, the pandemic, that's played a really unexpected and somewhat positive role in regards to working with the voluntary and community sector, because those in local authorities have been under tremendous pressure, as we all know. Overnight, services they knew many families were relying on were shut down. They found it very hard to reach vulnerable families and felt pretty helpless. But many local authorities began to think very creatively. They reached out in new ways. They forged new relationships with the voluntary sector, with faith groups and others, to ensure vulnerable families were helped. And as one local authority employee said to us, we tore up the rule, but why would we go back? And in that sense, the pandemic has broken old ways of working and has provided vital opportunities to build on these new partnerships. So finally, and really on that subject, I believe the pandemic has also exposed how families can become very fragile in these profound and prolonged adversities. There's a new sense of urgency, I think, in government that where possible, we need to prevent harms from happening and build resilience. And the emphasis in the McAllister review, which I've really lingered on to some length, the emphasis in Josh's review on prevention and relationships to build resilience is particularly welcome. Thank you very much.